It's been a gruelling 7 years for the Bennell Pickett family. Fighting for mental health support for family member Anthony, he suffers from paranoid schizophrenia and is finally getting the treatment needed at Rockingham General Hospital. The 23-year-old has been there for 3 months as an involuntary patient. That's because he poses a risk to himself or other people. But in the past 2 months, he's absconded from the hospital twice.
The first time I got a phone call from him on the highway saying that he wanted me to pick him up, and the second time was the doctor and the treating team had called me and said that he just left the hospital.
Mr Bennell is terrified of receiving a third phone call.
Serious harm to himself, to someone, if not death. Very serious.
Rockingham General Hospital has 4 secure or locked mental health beds, but involuntary patients are also treated in the open section of this ward, which is where Anthony was. A spokesperson for the hospital says patients on the open ward have their risk of absconding regularly reviewed. In the past 12 months, 367 involuntary patients have absconded from Perth public hospitals. 5 subsequently attempted suicide or serious self-harm within the next month.
Can I just say that every single bad outcome is a terrible outcome, and that's something we want to try and get rid of.
WA's chief psychiatrist says the number of patients that abscond reflects a less restrictive approach to the treatment of involuntary patients.
So many of the abscondings will happen from the open wards when people are potentially transitioning to the community. And so it's never going to be zero. We'd obviously like to get the numbers lower.
10 years ago, just over 17,000 people attended a public hospital emergency department in WA for mental health treatment. Last year, there were more than double that number, 37,800, the largest increase of any state. Dr Gibson says the system is under pressure because of the rising need for mental health services for children and a lack of services in the community.
We do need to, I think, remodel our community mental health services to meet the growing demand that we've had.
That's something the Bennell Pickett family is desperate for, with Anthony now in a locked ward.
If the people could sort of help him get his own place and all that, and like sort of live a normal life, yeah.
The family says Anthony's health is slowly improving and they're now working with providers on a care plan for when he's finally released from hospital. Samia O'Keefe, ABC News.